Crystal, I'll be your student nurse today. Can I get your name and date of birth? As they're saying this, I'm checking their wristband for the 2 identifiers as well as probably scanning it in on there. Today, I'm going to be changing your dressing on your central line on that port that you have. So they have, for demonstration purposes, we're pretending they have a transparent dressing on there. So I can see here through the insertion, at the insertion site. So I'm looking for any signs of infection, redness, swelling, ask the patient if they're having any pain. It looks okay to me. I've also assessed for allergies before I entered the room as well. So I'm gonna remove the patch and doing the no touch method. So remove the patch, put it in a bag. I'm gonna remove this bio patch as well. And then I'm going to get my things ready because I'm also changing that PosiFlow. So I have my saline. I'll connect it here and prime this port. So we're ready to go. Then I need to get out my dressing kit. The main thing to focus on here is maintaining a sterile field. So I have a mask for the patient. I'm already masked up, so I'll have the patient put this one on. I have my gloves here. And I'm ready to open my sterile field. This one doesn't come with a bio patch, so I'm opening this with my clean gloves without touching the inside or going over it at all. So the inside of this is sterile, so I'm gonna click that on, remove these gloves, hand hygiene again, and I'm gonna get my sterile gloves on. Okay. Okay, I have those ready. I'm gonna get my chlorhexidine. And I need to make sure I have it's coming out here. So I'm gonna go horizontally for 30 seconds. I'm sorry, that was not part of my skill demonstration. Just trying to keep the mask on. But that would have made it unsterile. So still 30 seconds. I want to make sure you get all around here. And you actually want to clean part of that line too. Okay, and then I'm going to go vertically for 30 seconds. All around where that dressing is going to be covering. Okay, and then I'm going to kind of go in circles here. Okay, that was 30 seconds. And now we need to allow that to dry. As that is drying, I'm getting ready to put my bio patch on, but we should probably let that dry for a full minute because you don't want any moisture under there at all. I also forgot to mention that when you're taking off the dressing, you want to be really careful with that line because you don't want to pull it out, and sometimes you may be tempted to use a scissors, but that's kind of just asking for a problem. You never want to accidentally snip that line. So if you're having trouble with it, you can kind of use alcohol on the outside of the dressing and kind of work your way around to get that disconnected from the skin, because you don't want to disconnect that line at all. Okay, and I'm still sterile here, so I'm going to get my bio patch on. I'm going to make my non-dominant hand dirty so I can get it around. And I'm just going to grab this part. The dressing. And I can grab my dressing, and for this one I would have a shirt and pants dressing. So I would remove the back, place this over through the shirt first, and then make sure that the IV tubing is within those little grooves on it. So we can kind of just stick that there and pretend I can visualize the site and see it. And now I want to change this cap. So what I'm going to do, I'm going to get my alcohol pad ready, make sure this is clamped, take that off and scrub for 15 seconds. Okay, and then I'll let it dry while I get this undone. And we'll attach our new PosiFlow. Give it, oh, and then I want to unclamp. A little push, and you want to make sure you always aspirate for a blood return. Again, if you don't get one, have them raise their arms, take a deep breath, cough. And then we're going to use the push pause method. Like that, I can clamp it. I'm going to wash it for 15 more seconds. And then some policies require one of these swab caps. I'm going to use a swab cap today. We'll have that capped. And then if policy requires two, sometimes they require a stat block, sometimes they don't. So what you could do is use tape and tape it down if it's getting in the way of things, but usually the shirt and pants kind of holds it okay there. So then I'm going to perform hand hygiene, kind of assess the site again, and document my findings. I want to document the type of dressing I used, what the site looks like, did I get a blood return, and the date and time. And I would write the date and time on the label too, with my initials, so that we know in 5 to 7 days we have to change that dressing again.